Awesome. Hi, everyone. Welcome to today's session with Dr. Dale. So today's session is brought to you by Inspira Advantage, an admissions consulting firm with extensive experience in helping candidates get into their dream graduate schools with scholarships. Dr. Ariella Dale is a public health scientist at Maricopa County Department of Public Health and an alumna of the CDC Epidemic Intelligence Service. Also, she is a current adjunct faculty member at the Arizona State University. Dr. Dale specializes in infectious diseases, but more recently, she's been involved in substance use and mental health. Lastly, she is passionate about working with vulnerable populations and incorporating sound public health work into support of our communities. So please give a warm welcome to Dr. Dale.
Good afternoon, morning, depending on wherever you're at. If you're on the West Coast like me, it's still morning. Really excited to be here with y'all today. Please give me one moment while I get my screen ready for you all. Okay. I heard y'all had lots of great questions in the last session, so please feel free to keep them coming during this session. So my name is Dr. Ariella Dale, and I am really excited to talk to you today about what a career in epidemiology can look like. I have a PhD and an MPH in epidemiology from the University of Georgia, go Dogs, and I currently work at Maricopa County Department of Public Health, which is in Phoenix, Arizona. Let's dive right in. So the first thing I would love to know is who has heard of epidemiology? Use those Zoom reactions. I see them coming through already. If you've heard of it, throw me a thumbs up, a heart. If you haven't heard of it, thumbs down, a sad face, whatever works to kind of vibe. Awesome. I love seeing all the little hearts and thumbs ups coming through. Some shocked faces. I'm guessing shocked probably means you haven't heard of epidemiology or know a lot about it. Awesome. Thank you. It's nice to hear that some of you have heard of epidemiology. Some of you maybe are a little bit newer to epidemiology. Let's talk about something else. Who here has taken an epidemiology class? Okay, looks like less people have taken an epidemiology class at this point, and that's okay. Thank you. Who has done work related to the field of epidemiology or done epidemiologic work? See a few thumbs up coming through, a little less. Okay. Thanks, y'all. This helps me to know what to kind of focus on and what to kind of lean away from as we're talking together here today. And lastly, who has ever thought about a career that it would involve epidemiology? Love to see the hearts, see some claps, see some celebrations. Yes, I love to see that. Awesome. Well, hopefully if you're here, it's because you've considered or just at least interested in learning a little bit more about what it takes to be an epidemiologist and what a career could look like for that. It's really exciting to see that a lot of you know what epidemiology is. I'm sure the pandemic has something to do with that. You may have taken a class, you may have done some work, and yet you're considering potentially a path that would involve epi. So for our time together, I want to take you through my journey to becoming an epidemiologist. My hope is that I will inspire you to think about public health as a part of your future career, if not the focus of your future career. At minimum, I really hope that some of the lessons that I learned along the way from being pre-health students just like you will help you as you find your path. So maybe you're like me. Well, at least me 15 years ago. I was an excited, enthusiastic undergraduate student, and I knew that I loved science. I loved math. I liked helping people, and I loved learning about new things. I started out pre-medicine and dove into all the extracurricular activities on top of my coursework. If that resonates with you, throw me a reaction in the chat if you're that person who's doing all the other things plus your coursework. See those coming through, you overachievers, you. I love it. So I'm sure many of you are also involved in research projects across many disciplines as part of your undergraduate careers or even graduate careers. Through research, you learn to think creatively. Like my undergraduate research project that focused on finding influenza receptors in clams. Then you're at the point where many of y'all are at or approaching, where you're thinking that when you graduate, you'll want to become some kind of clinician, whether that be an MD, a PA, a DO, a physical therapist, or so many other of the pre-health disciplines that we think about traditionally. Well, after I graduated, I spent the next year of my life working at a family medicine practice back in my hometown as a patient assistant. I had decided during my undergraduate coursework that I wanted to become a PA, a physician's assistant, and had spent time shadowing and volunteering at many local hospitals. I'm sure many of y'all have done that as well. Through this new experience as a full-time patient assistant back in my hometown and the only administrative support at the clinic, I had quite an awakening. I cared deeply for the patients that we were caring for, many of whom were suffering from various mental health conditions. I found that with time, it was becoming difficult for me to keep good balance in my life between work and caring deeply about the welfare of our patient community. I knew that with time, I wanted to help people and have a wide, embracing impact, but that if I went the clinical route, I may burn out early on in my career. With all this in mind, I decided to look into what my options were. With some soul searching, I found the field of epidemiology and public health. So let's break down what is epidemiology. The first thing I want to know is, can anyone tell me what the background of this slide is? Feel free to use the chat. I'm going to pause here for a second and see if anyone recognizes the background of this slide. Or even throw out a wild guess. Okay, we're on the right track. Thank you for folks throwing out ideas. It's definitely a city. It is not New York. It's actually London. So this is a map created by Dr. John Snow, and it's part of the cholera response mapping that he did when he was investigating outbreaks of cholera across London back in the 1800s. So if you thought of cholera, John Snow, or even just the word maps, which many of you did, you'd be correct. Dr. John Snow was considered one of the earliest epidemiologists and is infamous within public health for his approach to disease investigations, leading to how we approach public health today. Now let's break it back down, the word epidemiology, and keep it super basic, like SAT prep style. So SAT prep style, we know that epidemiology comes from the Greek words epi, meaning upon, demos, meaning people, and logos, meaning the study of. Or more formally, epidemiology is the study of the distribution of determinants of health related to states or events in specified populations, and the application of this study to the control of health problems. To pursue a career in epidemiology, many people pursue a Master of Public Health from an accredited program across the nation or across the world. That's exactly what I decided to do. Through pursuing an MPH in epidemiology, it sincerely opened my eyes to a world where I could bring all of my skills together: math, science, emotional intelligence, customer service, all the things that I learned being a patient assistant, researching, doing undergraduate work, and so much more to help people and make a difference. As part of my MPH program, I quickly decided to concentrate on epidemiology with a disaster management certificate. Through my graduate coursework and research, I learned not only about the fundamentals of public health, but dove into new subject areas like molecular epidemiology of a fungal infection among people with and without HIV. I attended national conferences representing my university program, learning and networking with public health professionals across the United States and world. And I even got to take fun, cheesy photos in the process. While you may think a lot about the coursework of epidemiology and that a lot may occur behind a computer, the field is very diverse. My MPH took me in other unexpected directions. For example, I did my practicum with the United States Department of Agriculture's Agricultural Research Service. I spent the summer in the field literally sampling chickens and their feces throughout their life cycles from egg to slaughter for various bacteria, including Campylobacter, Salmonella, and much more. I would help culture these samples, track the data, and even go out to the fields to do the sampling. So you can say that going out into the field really had a different meaning, including in this photo, which, forgive me, y'all, 15 years ago, cameras on phones weren't what they are now, included feeding a baby goat that was at one of the homes of the farms where we were sampling chickens. So that was really a lot of fun and showed me a different side of public health and understanding how diseases enter the life cycles of the animals that we eat in a One Health approach. All in all, my MPH experience was stimulating to my mind and really feeding my soul in the ways that I had hoped. I then decided to immediately pursue a PhD in epidemiology, applying to programs the fall of my second year of my MPH program. This was a really tough decision for a number of reasons. So I thought about three main questions when deciding if I should get a PhD, and I want to share these with y'all because I think it's important and that you will consider similar questions when deciding to pursue any kind of education or training past an undergraduate degree. The first thing I thought about were my life goals outside of work and outside of my career path. I had a fiance to consider, what kind of future that we wanted to have together, and how feasible it would be to return later in my career to get a PhD or any other equivalent education. The honest truth is, getting a PhD is not a money-making adventure, as you often live on a graduate student salary through an assistantship, so you're working to pay for your schooling at the same time. For me, I decided that I wanted to go straight into my education in order to minimize any risk that I would not want to return to living a life with that kind of lower income, the long hours, and an inability to kind of focus and set time aside to working on my PhD. The next thing I considered was, what was the career trajectory that I wanted for myself? I had heard about some graduate training opportunities only available to PhDs, which we'll talk a little bit more about that later, and knew that I wanted to be able to lead a team one day and help make decisions that would impact and have positive changes for our community. To do that, having more education would be advantageous. The final thing I thought about was that I did love the subject area, and I needed to know, did I love it enough and have the resilience to keep going? Getting a PhD or any kind of terminal degree in the graduate professional field is a labor of love. There are many people who choose not to complete their PhDs or other degrees after starting. They end up what we call all but dissertation because it takes time, dedication, and can be a very emotionally trying experience. It takes a lot of time and resources from you and from your family. I knew that I loved what I had learned so far. I wanted to keep learning and growing, and had identified mentors that I wanted to work with going forward. In your journeys, think about these questions and even other questions when deciding your path. Don't just end up on the path because it seems like the right thing to do. Make sure that you're moving intentionally when making decisions about the journeys that you want to take. So through my PhD, I explored all aspects of epidemiology, specifically focusing in on infectious disease epidemiology. During that time, big public health crises were occurring, such as the Zika virus outbreak among pregnant persons, resulting in microcephaly in infants. As you can see here with this poster where I worked on a Zika virus response plan. On the other side of infectious diseases, I had an epidemiology job with Emory University, helping to recruit pregnant persons into what was called the Moms Talk Shots randomized controlled trial. So speaking with pregnant persons and having them review the Moms Talk Shot application. Oops, sorry, y'all. Sorry if you heard my dog barking. Through these experiences and many others, I focused on infectious diseases and ended up focusing on respiratory diseases for a majority of my research work and dissertation. My PhD experience also offered me the opportunity to work on many teams with undergraduate, master's, veterinarian, PhD, medical, and so much more students and people who are already within the field. We tackled many public health issues, a snapshot of which I presented here. After 3 years, we worked on vector-borne diseases and all sorts of different things. So at the end of my 3 years, I graduated with my PhD in epidemiology. This is me and my now spouse, Michael, with a dissertation focused on influenza and clinical decision rules. You can see on the right, that's one of the publications resulting from my dissertation. Following graduation, I had many paths to choose from. So you get all this training. It's like, what's next? What do I want to do? How am I going to take this degree and this training and go and make a difference in the way that I want to? So after getting a PhD in epidemiology, there's a lot of career paths that you can take. This can include academia, non-governmental organizations, governmental agencies, pharmaceutical, medical device, et cetera, companies, consulting, and really there's so much more. There's lots of flexibility that can be offered with a degree in epidemiology, whether it be an MPH or a PhD. For me, I found my path in governmental agencies. My father is a lifelong civil servant. I had heard, of course, of the CDC and NIH during my undergraduate and graduate training, and I decided I wanted to learn more about what state and local health departments do. The week after graduating with my PhD in epidemiology, I started my first postgraduate job as a healthcare-associated infections surveillance data coordinator in Colorado. I was quickly introduced to the inner workings of a state health department, which is different, of course, than federal or local, and a large team of people working hard to combat many public health issues facing the community, specifically around infectious diseases. I spent 2 years working at Colorado and was responsible for ensuring a robust and accurate reporting of healthcare-associated infections in a national surveillance system known as the National Healthcare Safety Network. I also served as a subject matter expert for epi design and supported special projects. Here's an example of a report I led, which was the annual report on healthcare-associated infections in Colorado. I also led a collaboration of inventorying antimicrobial resistance data, developed visualizations to give public-facing interactive tools for a hepatitis A outbreak, and so much more. I wanted to highlight these things because we remember I just recently talked about my graduate training and I focused on respiratory diseases, and healthcare-associated infections are not respiratory diseases typically or have a respiratory presentation. So I got to take my skills and apply it to a completely different subject area. And that's one of the beautiful things about the fluidity of epidemiology and the skills that you learn, is that you can take this tool set that you get and apply it to different areas and still be useful and make a good impact. During my time at CDPHE, I had a wonderful mentor and supervisor and learned about the CDC's Epidemic Intelligence Service and was encouraged to apply. I also had heard about EIS, or Epidemic Intelligence Service, during my graduate training, and my mentor at CDPHE strongly encouraged me to apply, and I want to tell you a little bit more about the EIS program. If you think about major public health events or emergencies, CDC and EIS were there. As you can look through this timeline here, across all of these different responses, most recently, of course, being the COVID-19 pandemic and the Mpox outbreak response, EIS officers have been involved throughout. To give a recent example, as of May 31st, 2022, 75% of EIS officers in the 2020 and 2021 classes have supported the COVID-19 response. That included 244 deployments from the CDC emergency operations centers to field locations, 9,163 deployment days, and 95% of the EIS officers assigned to state and local health departments worked on COVID-19 local response activities. So this applied epidemiology training fellowship for 2 years offered these officers the opportunity to support a major public health crisis. This map here reflects the locations for EIS officers in the classes of 2021 and 2022 across the United States, including CDC headquarters in Atlanta. There's also field stations for CDC in Alaska, Fort Collins, Colorado, the District of Columbia, and the US Virgin Islands. Assignments for EIS officers are made on a 2-year fellowship basis and do not reflect the map here does not reflect deployments or FEAs that were requested at the time. EIS officers that are placed in what we call the field are embedded in state and local health departments where they work side by side with public health staff at the local and state levels. CDC EIS officers, or what are affectionately known as disease detectives, come from a variety of disciplines with an interest in field experience and a passion for service. Some of those backgrounds include all sorts of pre-health disciplines, allied healthcare professionals, doctoral level scientists like myself, a PhD in epidemiology, microbiologists, psychologists, nurses, physicians, veterinarians. Pictured here as an example is Dr. Howard Chu, who had an MD and a PhD. He was assigned to work in the Los Angeles County Public Health Department. The EIS program is the world's longest running field epidemiology training program. EIS officers are employed by the CDC, where they are supervised and mentored by epidemiologists and other scientists recognized as subject matter experts in their respective fields. In this photo is actually my EIS classmate, Miriam Van Dyke, where she was helping to collect swab samples for a validation study of a rapid antigen test for COVID-19. So the EIS program, there's really nothing like it. It provides 2 years of on-the-job learning and fieldwork. You are guided by CDC experts and EIS alumni and have unparalleled opportunities to work as part of interdisciplinary teams to detect and respond to new and ongoing public health threats. For example, here's Kelsey Sumner from the EIS class of 2021 in Mwanza, Tanzania, during a poliovirus response in June 2022. As an EIS officer, you have opportunities to work at CDC and state and local health departments be part of those interdisciplinary teams, and contribute as part of a service and learning program. Excuse me. EIS is a great gateway to a strong foundation and successful career in public health. Just to highlight some of the accomplishments of this classes, there are over 900 peer-reviewed scientific publications authored by EIS officers from the class of 2015 to 2020. And as of August 2022, 98% of recent graduates continued in public health-related positions. 4 of the last CDC directors are EIS alumni, and 24 are CDC country and regional office directors are EIS alumni. You can see the breakdown here across. I was lucky enough to be accepted into the EIS class of 2020, 2020 being the year that we started, not the year that we graduated. Here's a breakdown of what my class's training looked like. You can see on the left-hand side here that 21 of my classmates of the 60 were physicians. Some had master's degrees in public health, some did not, some had other master's degrees and came from various clinical specialties, emergency medicine, pediatrics, internal medicine, infectious disease, so much more. On the right-hand side in the red pink box, we had 6 veterinarians in my class. We had 5 nurses, 1 physical therapist, and then 27 doctoral level scientists such as myself, all from varying backgrounds. So you don't have to be a PhD in epidemiology like me in order to be a part of this training fellowship. Keep in mind that we started as my class in July of the very first year of the pandemic, approximately 6 months into the pandemic response. So that very much influenced our experiences. I want to take y'all through some key highlights of my EIS experience. First, when you join EIS, you can join as a civilian or choose to commission through the United States Public Health Service, pending that you meet qualifications. So I chose to pursue commissioning through USPHS, as you can see through the photos of me in uniform. I'm pictured on the right there, making a kind of a silly face, with my classmate on deployment to Tucson, Arizona in November of 2020. We were part of a team tasked with assessing the performance of the brand new, at the time, Bionex Now COVID-19 rapid point of care tests. Through that project, we found that the test performed well for people with symptoms, but poorly for people without. Another highlight of my EIS experience, so taking applied epidemiology and putting it into action, was developing a refugee outreach team for the county's COVID-19 response. I guided, hired, and trained community health workers who had previously resettled as refugees in Arizona to help our outreach efforts to provide culturally competent care. Through this effort, the community health workers conducted case investigations in the languages of the people they were talking to, did educational events, coordinated COVID-19 testing, and eventually vaccination events at trusted locations throughout the county. This is the work that I am most proud of during my EIS experience. It was incredibly humbling and beautiful to learn about so many different cultures and to work to bring public health resources to those communities. On the other side of public health is One Health. I was able to be involved in many One Health initiatives, including rabies vaccination and tick check campaigns on tribal lands. So you can see here's me with several different dogs, which is just a small fraction of all the dogs that I met during this, which is a lot of fun. I got to meet lots of cute dogs, increase rabies vaccination coverage, and help remove ticks to be tested for Rocky Mountain spotted fever by our academic partners. It's hard not to love a day that goes with work and involves 4-legged friends. Throw me a reaction if you enjoy a day where you get to pet a dog or a cat or anything. Thank you. I'm glad to see I have my people out there. Throughout my EIS experience, I deployed several times throughout the United States to support public health agencies. I met folks from so many different training backgrounds and learned about many infectious diseases I had previously had no experience with, which is an advantage of being assigned to a field site I was assigned in Arizona. And for me, one of these deployments resulted in the rescue of a dog who's now joined our home permanently, Meet Tater Tots. That's not a requirement of the EIS program, but I was lucky enough to grab another dog to join my family that was living and needed help. My EIS journey ended with an investigation into a norovirus outbreak among rafters and backpackers in Grand Canyon National Park backcountry. Through our support, this multi-agency response identified 222 people sick with acute gastroenteritis while in the backcountry of Grand Canyon. This was an incredible way to cap off my EIS experience with one last field deployment to learn how the National Park Service Office of Public Health, Coconino County Health and Human Services, Arizona Department of Health Services, and the CDC all came together to respond and mitigate the outbreak. And I just want to emphasize what this experience was like for this community. When you're in the backcountry of Grand Canyon National Park, that means no access to services. You are literally down in the canyon bowl. So throw me a thumbs up or a heart if you've ever been to the Grand Canyon. And I think you'll understand how it can be very dangerous to be sick down in the bottom of the Grand Canyon with, when you're talking about norovirus, aka nausea, vomiting, and diarrhea. That's not a very pleasant experience while you're camping. These last few slides, I want to give you a brief look. I gave you a brief look at my EIS experience, and I hope that it has inspired you. I heard about EIS during my graduate training and then was encouraged to apply when working in Colorado. If you decide you really are ready to make a difference, or maybe in the future, you might want to consider this, go check out the EIS website. The applications are open in the spring. It's always great to meet other fellow EIS officers, alumni, and current officers to hear about their experience. No experience is exactly the same, but you gain incredible applied public health training, and it's an awesome option for anybody in the pre-health track once you've completed some graduate training. To learn more, just check out the EIS website. Also, think about virtually attending the EIS conference. So every spring, this coming year will be in April, there is a free conference that is a great way to learn more about public health and what EIS officers do. Following my incredible 2 years, I decided to stay on at the local level, specifically of Maricopa County, and was offered a role as a public health scientist. As part of my role, I support across the entire division in the reportable conditions we encompass. This includes many infectious diseases, substance use, mental health, heat-related illnesses and deaths, health equity, and much more. Here's some few highlights of the last few years, including vector-borne and zoonotic diseases, such as the very first locally acquired dengue virus infections in Arizona, and an incredibly big outbreak of West Nile virus, the second largest in US history. Another example is detection of hantavirus during the COVID-19 pandemic, support of an innovative tool for the mpox response in Maricopa County, and most recently, innovative projects to tackle our extreme heat in Arizona to prevent heat-related illnesses and deaths. I'm really fortunate to still be a generalist and applying my PhD epidemiology training in tandem with medical epidemiologists, laboratorians, veterinarians, other epidemiologists, and much more. I am also lucky to partner with professors at academic institutions throughout the state and continue to meet students. I hope this presentation has been helpful. And as you continue your journey as pre-health students, think about a career in epidemiology and how it could be part of your journey, whether it be working within the field directly or even incorporating a public health lens within your future work. As you go forward, keep the following things in mind. First, stay open-minded to how your skills and talents can lead to a different path for you. Second, continue growing. I'm always happy to recommend books, podcasts, documentaries as you explore public health. Third, think about taking a public health class or doing an internship. There's lots of ways to incorporate public health and epi into future careers. Fourth, talk and network with people who do jobs that you find interesting. And finally, look into all kinds of post-undergraduate training opportunities. Maybe it's med school, maybe it's graduate school, joining the workforce, an internship, Peace Corps. There's so many different paths. I hope that this inspires you to keep epi in your mind and think about EIS in the future. There's so many remarkable epidemiologists out there doing great work, and I'm happy I got to share a little bit with y'all. With that being said, thank you so much for your attention this morning. I really have enjoyed sharing parts of my journey with y'all and am happy to take some questions at the time. If you prefer, please feel free to email me.
Awesome. Thank you, Dr. Dale, for presenting such a great insight on just the entire journey that you went through and all the decision-making you had in pursuing a career as an epidemiologist. So to start off, our first question is, how can someone get involved with public health as an undergrad?
That's a fantastic question. So the obvious answer is probably, does your school have a public health program? And if it does, reach out to instructors and professors over there to see if they have openings within their research, if they need assistance, excuse me, if they need assistance with any kind of research projects. I was really fortunate to work with undergraduate students. During my PhD training, we had a specified research group that was purposely designed to engage undergraduate students into learning about public health. So look for opportunities in organizations like that. I met some wonderful undergraduate students who helped me with systematic reviews and meta-analyses, and have now gone on to medical school and veterinary school. So it's a really great way to find out if there isn't a public health program at your school. Consider maybe some surrounding schools. A fair amount of epidemiology can be done at on a computer. And the best thing to do, really, I highly recommend, is to think about your local or state health department. There's always needs within those health departments to have an intern, to have bright people like y'all involved in helping. So think about looking at their internship programs and talking with your state or local health department.
Great. To become an epidemiologist, is it required to have a PhD? And if it isn't required, why did you, since you kind of answered in presentation, what has the PhD allowed you to do that an MPH in epidemiology would not have?
Yeah, that's a great question. So for epidemiologists in general, an MPH is considered a terminal degree. So for most jobs in epidemiology, thinking traditionally for governmental agencies is what I'm speaking about, because that's most of my experience. Having an MPH is considered sufficient for training. You can have a bachelor's plus experience, but having an MPH opens a lot of doors and can lead to a lot of opportunities. I chose to get a PhD because I felt like that it would give me more skills and experience in epidemiology that I could apply across lots of different disciplines, which I've actually gotten to do. Oftentimes with an MPH, you may end up on a track, like you are focused on influenza as your first job, and then you kind of stay within the respiratory world and rise through the ranks. And you certainly can become leadership with an MPH. There's state epidemiologists out there. There are even health department directors that have an MPH only, and that's still wonderful. For me, I really enjoyed understanding all the nuances of study design and statistics, and wanted to be able to take those skills and apply them across many different disciplines. That's why I chose a PhD.
Sounds so exciting to hear that, that difference. And so now as an epidemiologist, what does your day-to-day life look like?
I love this question. It's a hard one for me to answer because of the type of role that I'm in. So in my role, as I mentioned earlier in the presentation, I work across our division of epidemiology and reportable conditions, including many infectious diseases, substance use, mental health, heat-related illnesses and death, health equity. That's a lot of different areas and a lot of different disciplines. And I help support our epidemiologists in doing special projects and trying to come up with innovative ways to help support our communities. So a day-to-day for me can look like meetings. It can look like writing some code within a program such as SAS or R. It can look like giving presentations like this and meeting undergraduate and graduate students. It can look like going into the field and working on surveys with our community, meeting people, bringing resources. So it's never a dull moment for me in my role as an epidemiologist. And I think that for a lot of epidemiologists, their day-to-day does stay, it is a lot of kind of behind the computer working and ensuring that the data that's being received through surveillance is accurate and that we can report it out and share it with the public so that we're communicating science well and people are empowered to make decisions and to prevent serious infections and illness.
That's so awesome to hear the variety of experiences you have, and also like the variety of things. So from meetings, from actually doing field work. So coming from that plethora of experience, what is something you wish you would have done differently? And what do you know now that you wish you knew sooner?
I am really happy to get this question because this is the exact dialogue I was hoping to inspire. I was one of those people who went into undergrad, as I kind of alluded to earlier, and I was like, I'm going to be a doctor. And that's what I thought I wanted to do my whole life. I'm going to be a doctor. That's how you help people. You become a clinician, and that's how I can have my greatest impact and use my skills. And I wish that earlier on in my undergraduate training, someone had said to me, what about public health? What about a bench science and laboratory and degrees? And just kind of opened and pushed myself to think a little bit outside the box of you can only be a clinician to help people. There's so many ways within public health that you can help, and other disciplines as well. And I wish that I had been pushed a little bit sooner to think about it. I don't regret the path that I took. And the year that I spent as a patient assistant in that family medicine clinic, working primarily with psychiatric patients, really taught me a lot about myself as well. I kind of envisioned, I don't know if there's probably other folks in the audience out there. If you are, throw me a heart or a thumbs up. I was going to be the person who was like working with underserved communities, throwing on the backpack, like with all my supplies and going around and just helping people, whether they're experiencing homelessness, whatever it was. And I realized that I could still do that, use my skills, but have an even more impact by kind of zooming out to the macro level for me. So that's the advice I have, is to stay open-minded, think about different paths, and recognize that you don't have to do it all as fast as possible. You're competing only with you and the goals and the life that you want to build for yourself.
I love that advice. I think there's, as you can see, there's like claps in the audio in the chat. I think we all really enjoy that advice because there has been a time where we've been told like to quickly figure out what you're doing, but you're not really sure yet. So it's really nice to hear from someone who has went through the process, like, you take your time to figure out what your passions are. And can you get a job with epidemiology, since we mentioned about clinician, with just a medical degree, but you're concentrating in epidemiology, or is it an MPH required?
That's a great question. So epidemiology itself is not a specialty that you can focus in as a clinician. There are folks who choose to do a preventative medicine residency or fellowship, which is very public health focused, and it is a great way to kind of be cross-trained between a clinical science with medicine and then also with public health. You do not have to have an MPH in order to get a job as what is called a medical epidemiologist, so an MD who is trained in epidemiology and works at a state, local, or federal governmental agency, as an example. You don't have to have one, but it certainly doesn't hurt. And more MD programs and DO programs, PA programs, nursing programs are offering co-concentrations with MPHs. And so if you are thinking about a career in public health, or think that maybe you want to incorporate public health themes within a practice one day, or a hospital that you're working in, whatever, think about getting that MPH. It'll help kind of round out your mindset so you can even interpret the guidelines and guidance that are given by public health agencies in an even more kind of nuanced way, and understand the perspectives of public health versus individual care even better, even if you don't go and become an epidemiologist in a health department.
Awesome. And I think we only have time for one more question, but it was a nice transition you mentioned about combined degrees, because our audience is curious. Can you share what someone who has a combined degree, an MD as well as an MPH program, could do with both of those degrees?
Sure. There's a lot of examples of, excuse me, there's a lot of examples of MD, MPHs out there, specifically in our health department. I work closely with an MD, MPH medical epidemiologist. He's the assistant medical director for our health department. Our medical director is an MD and did the EIS program. So they are involved at the local level in interacting with state and health, federal departments like CDC. There's lots of MDs, MD, MPHs who work there. There's the other side of it too. You can, of course, go down all the different paths I highlighted earlier, but those are my primary interactions. Is MD, MPHs are often viewed, they have a unique skill set. So I'm a PhD, so I'm called doctor, but like I do not have the same skills as an MD, and vice versa. My clinical counterparts don't necessarily have the same study design expertise that I do, or statistical or coding, things like that, able to do analysis with data. So it's kind of two sides of the same coin, and they work very much hand in hand. So I work daily with MD and PHs at the local, state, and federal level that are doing public health.
Awesome. Thank you for answering all our questions. I know we had more, but you put your email. We're also releasing an email so people can email you with more questions that we didn't get to. But thank you so much, Dr. Dale, for coming to talk about what a career in epidemiology looks like. And for everyone, thank you for the fantastic questions. And up next is our sponsor expo. So feel free to leave the webinar, go to the sponsor expo on the top and visit all our booths for the amazing takeaways that we have. And then thank you again, Dr. Dale.
Thank you all so much. It was wonderful to speak with you all today. I loved the questions. Please feel free to reach out to my email address. I think that it looks like Alexia has put it in the chat for me, but it's ariella.dale@maricopa.gov. Have a wonderful day.